welcome to our channel DocITBabiezz. I'm Sunita Ghosh. So we are back again with a very basic video, but I think in my personal opinion, when I was a new mom and Inaya was very small, Inaya was just a newborn. So these basic kind of videos I used to love because sometimes these are the things that you have to deal in your day-to-day life when you have a baby with you. So these kind of videos are actually very helpful, and that is why I try to make videos on these basic kind of things, so that I can share my experience and I can help you moms, you new moms, so that you are going wrong nowhere, and you are using right techniques and right way to take care of your child. So basically, this video is about cleaning your baby's tongue. So basically maintaining baby's mouth area hygiene, which is very important, because if the whole body hygiene is important, then again your oral hygiene is equally important, and if not taken care properly, then it might lead to infections. So we never want to reach to that kind of level that our children start suffering from any kind of infection. So it's always better to take care of the oral hygiene as well. So this video is basically on that. So without wasting any time, let's start with the video. So if you like our video, then please click on the like button, do subscribe to our channel, and just share our videos with other moms also, so that they can also gain some kind of help from these kind of videos. So basically nowadays most of us, we are in a nuclear family setup. So just the husband and wife is responsible for taking care of the child. So it's very important to know these small basic things that you have to deal with in your day-to-day life basis when you have a child, of course. So it's very important to know these kind of things, and always make well-read actions with your child, because it's very important that you are going wrong nowhere. And that is why I'm telling you about this. And secondly, even if you have parents to advise you, so obviously you should always give a lot of importance to your parents' advice, but they might be wrong sometimes, because at their time they used to follow what their elders used to say. So they never used to question what is right, what is wrong, and sometimes that could lead to problems with children. So obviously at this age, when we are well read, we have internet, we have videos, we have lot of articles to help us make a guided decision. So it's always important to make a well read decision. Always listen to your elders, but still read what is right and wrong, and then make your own decision. Sometimes you have to make them understand that this is not the right way, or this might cause some kind of issue to my child. So that is very important. So before I tell you about infection that might lead because of not taking care of oral hygiene of your child, we will first discuss that what are the correct ways to actually clean your baby's tongue. Okay, so the first and foremost way which I used to use very frequently was using a cotton cloth. So you can use a cotton cloth / a gauze, cotton gauze. So basically I always used a cotton cloth, a cotton hanky, washed properly. Okay, so first clean your hands properly, because your hands are going inside your baby's mouth. So clean your hands properly. Take some RO water and boil it first, and let it cool down to a warm kind of level, lukewarm kind of level. Now take a hanky and cover your finger with that cotton hanky. Now dip your finger in that warm water. Use your other hand to gently press your child's mouth so that it opens little bit, and then you can use the second hand finger to gently clean that area. Never apply any kind of pressure to clean baby's tongue. Just go for circular movement and clean baby's tongue that way. After cleaning baby's tongue, it is also important to clean the gum area, so the upper gum area as well as the lower gum area. So this is how you are going to clean your baby's tongue as well as the mouth area. This was the first way. The second way is using a finger brush. So basically finger brushes are also very good because they are silicone made, so they can easily be sanitized after every use. Okay, you can easily fit the finger brush in your finger, and then use that finger brush to clean baby's tongue area as well as the gums. These are very soft, so they will never hurt your baby's mouth or your baby's tongue or gums. So it is very safe to use them. And secondly, since they can be sanitized after every use, so they are very they are quite I would say better as compared to using a cotton cloth. So after a while, after using cotton cloth for a while, I switched to finger brush because I found that this is better in case of passing infection to your child. So that is why I used to use a finger brush to clean my baby's tongue. So these are the two ways which I used to use for Inaya, and I think these are very simple and they are very safe to be used for your baby. Now comes the term oral thrush or mouth thrush, or basically an infection that your child might get because you are not maintaining that proper oral hygiene in your child. So because basically the child is always drinking milk every 2 to 3 hours in the first few months, so lot of milk residue is present in the child's mouth, like basically on the tongue area it's present. So it's very very important to clean that part, and if it keeps lying there then it might lead to infection. So basically oral thrush, the term oral thrush is basically a fungal infection that happens in your child mouth. So how do you basically differentiate between either your child is suffering from an oral thrush or it's just a dirty tongue? So in case of oral thrush, you will see a white flaky layer on your baby's tongue. That layer is somewhat it would be something like a cheesy layer or a layer of curd that you can see on your baby's tongue, but also that white patchy thing would be present on your baby's gum area, on the side walls of the mouth, or even the lips. So in case just a tongue is dirty, so you won't see any kind of whitish layer on the lips or on the side area or on the gums. But in case your baby is suffering from a mouth thrush or an oral thrush, in that case the layer would be present on the tongue as well as on the sides or the gum part or the lips part. So that way you can differentiate that your baby is suffering from an infection or it's just a dirty tongue. Also, in case of an oral thrush, when you try to clean that white area, then it is very difficult to clean it, and basically it is not easy to clean that part. But in case your baby's tongue is just dirty, so using the two ways that I mentioned, you can easily clean that part. So that is the difference between them. Now, I would like to say that oral thrush is not something that you have to worry about, because mostly when you start, taking care of your baby's oral hygiene, then it would go away by itself. But if you feel that it is not going away by itself and it is actually the condition is becoming severe day by day, in that case you have to go to the doctor, because an antifungal medication has to be provided to your child, because oral thrush is something which if becomes severe, it might lead your child to not taking feeds, because the child would feel pain while taking feeds. So that is why the baby would stop taking feeds. So obviously we don't want any kind of those kind of conditions. So obviously take care of these things, and if you see any kind of these signs in your baby, then obviously your baby is suffering from an oral thrush and you have to go to the pediatrician. Also, if you are a breastfeeding mom, then that oral thrush or the mouth thrush can transfer to you through your nipples. So in that case, you would have, cracked nipples, or you might feel pain while you're feeding your child. So even while feeding and after feeding as well, you will feel some kind of pain. So that means even the thrush has transferred to you, and you also have to take any kind of antifungal medication. So you also have to go to the doctor for that kind of medication. So basically this was about how to maintain oral hygiene, and if you don't maintain oral hygiene, then sometimes it may lead to an infection called oral thrush. So before finishing my video, I would just like to tell you that always whenever you want to clean your baby's tongue, just keep in mind that it has to be done once in a day, but take a time when you feel that your baby is happy, and secondly that it shouldn't be immediately after a feed, because immediately after a feed, if you try to put your finger inside your baby's mouth, then the baby might vomit the milk that he or she took inside, and that is something that you don't want. So don't do it immediately after a feed, and secondly choose a time when your baby is in a happy mood. So this was all about cleaning your baby's tongue and basically maintaining oral hygiene of your baby's mouth. So I hope that this video was helpful for you, and if yes, then do click on the like button, do subscribe to our channel, and enjoy this happy world of parenting. Docket Baby rocks. Bye bye.